Good morning. This morning, I'm Dr. Camille Hammond, CEO of the Cade Foundation, and I am thrilled to introduce you to Dr. Stephanie Beall, a reproductive endocrinologist at Shady Fertility, who has lots of experience advocating for legislation that would expand access to care for fertility care for cancer patients and cancer survivors. So, Dr. Beall, thank you and welcome.
Oh, thank you so much. It's a pleasure being here and quite an honor.
Absolutely. So this is particularly relevant because there is an advocacy day that is coming up in June. So hopefully after people listen to this, they will go to resolve.org and sign up so they can be a part of this process as well, advocating on a national level.
Absolutely. It is so powerful to have individuals who have gone through the struggle talking to our representatives. It makes a huge impact on how they look at, interpret, and the legislation and the decisions that they make moving forward in order to help all of our patients.
Awesome. So, Dr. Beall, can you speak very briefly about some of the things that you testified about and the resulting legislation that changed?
Absolutely. So we're very lucky here in Maryland to have a fertility mandate that helps people be able to undergo fertility testing, fertility care, and helps to sort of open up access to people and break down that cost barrier that oftentimes is insurmountable for couples struggling with fertility. The fertility mandate actually came into being in 1985, sort of spurred by a grassroots organization of a woman who was struggling with endometriosis and needed IVF to conceive, and was finding that she was not able to get any insurance assistance in order to pay for the treatment. Since then, there have been a lot of revisions to the bill, and more recently, I was involved in several efforts to expand the bill to cover donor sperm services, which helps our same-sex couples, in addition to our couples who are suffering from infertility due to severe male factor, where men may not be able to produce viable sperm to impregnate their wives, and so allowing them to undergo treatment and care with donor sperm. Also worked on the fertility preservation legislation in order to open up the mandate to include fertility preservation coverage for women and men undergoing gonatotoxic treatments that may render them sterile after they survive the condition because of the treatments that they need to undergo. And then most recently, we worked to break down some of the other barriers to care, removing the marriage exclusion, decreasing the wait time. Maryland had a wait time of 2 years of infertility before being able to undergo fertility treatments, which, you know, the definition of infertility for women less than 35 years of age is 1 year, and for women 35 years of age and older was 6 months. So to have them wait 2 years could potentially significantly decrease their chances of success with care. And so we worked in order to decrease that time duration to eliminate that barrier.
Awesome. So I actually have your resume, and you've been very active in Maryland in helping expand care. Can you tell me a little bit about some of the efforts nationally?
Yes. So there's actually a bill that is active at the federal level. One of the reasons that this is important is because our federal employees are exempt from any state mandates. And so even if a federal employee living in the state of Maryland which has a fertility mandate, because of the fact that their insurance is from a federal level, they cannot access care. And so this Access to Infertility Treatment and Care Act, which is an active federal bill, will help to expand that to our expand fertility care to our federal employees. And also within that bill, it has wording to expand that care or to include within that care fertility preservation for iatrogenic infertility.
And can you define iatrogenic
Oh,
infertility?
I'm so sorry. So treatments that may render someone infertile after they go through a treatment for another reason, another medical condition.
So that's very important. Again, and for those who are open to participating in the Resolve Advocacy Day on, well, I guess it'll be virtual. I'm not sure if it'll be virtual or in person, but regardless, if you're open to participating, this is the legislation that you'll be speaking with your senator and delegate about this summer. Now, I know that Maryland is one of the states that has a state mandate, and I'm sure that the legislators don't like the word mandates. You know, I'm sure that there's probably another term that they prefer, but can you talk about some of the other states that have set aside or that are requiring insurers to provide some form of coverage for patients?
Yes. So currently there are 19 states in the United States that have some sort of insurer mandate to cover fertility services. Now, these mandates are very variable as far as what types of treatments are underneath that mandate and who has access to funding, insurance funding underneath those mandates. And it's spattered throughout the United States. There's no particular area in which it's congregated, although the Northeast, we tend to have, I guess, a little bit more as far as a percentage of states that have a mandate than throughout the Midwest and the Southern states.
And those mandates would require, what do the mandates typically require?
So the mandates typically require employer healthcare or employer insurance programs to cover some sort of fertility testing or treatment. Now, it is very variable. So some of them only cover testing. Some cover some what we call lesser treatments, such as surgery or inseminations. And then others cover in vitro fertilization as well. Of the 19 states that cover some sort of fertility testing or treatment, only 13 will cover in vitro fertilization.
Awesome. All right. So that means you need to, if you're watching this and you are struggling with infertility, whether you're a cancer survivor, cancer patient, or not, you should go to your HR department and ask, because you may live in a state where there is a mandate where your treatment is already covered. Thank you so much. I know Dr. Beall has to see patients in 6 minutes. I appreciate your time, and I'll talk to you soon. Take care.
Thank you so much. Thank you.
Bye.
Bye.